Hello, my name is Naomi. I'm one of the paediatric physiotherapists that works with children with cystic fibrosis.
I'm Claire, I'm also a physiotherapist and I work with the cystic fibrosis team.
So today we are going to be having a little look at how to use an airway clearance technique called a Pari PEP. The Pari PEP device is a form of chest physio clearance that helps to mobilise secretions from the more distal airways to move them into the more peripheral central airways, so that once you've cleared your chest out, you can puff and cough and spit out secretions or expectorate secretions from your chest. So today we're going to have a little look at using this device. So there's 4 main parts to the Pari PEP. So I'm just going to briefly take it apart so you can see how they all go together. And these 4 parts basically worked on the breath out. So basically what you're going to do is take a nice breath in through the PEP, but then as you breathe out, there is a different size holes and different size resistors. Okay. And those resistors basically create the pressure that's generated inside the lungs. So we're going to have a little play with this and have a try and see how you get on with it first of all. So there isn't a right or wrong hole size that you should be on. We just need to have a monometer in the circuit, which then will dictate how big a breath that you need to be taking to achieve the right and correct pressures. We're going to start off with the smallest hole. So the smallest hole on the PEP is a 1.5 hole. So what I would like you to have a go at doing is sitting nice and upright, shoulders back and relaxed, and then if you pop the mouthpiece into your mouth, okay, so we want to create a really good seal, so we don't want any air to be leaking out around the sides. Now I want you to try and breathe in through the PEP, and then take a nice prolonged breath out. So breathe out, keep going, keep going, keep going, keep going, and relaxed. Now that's exactly how we'd like you to do each of the breaths, and what we're going to do is build each of those breaths up into 10. But what we need to do first of all is get a manometer to put into the circuit, okay? So Claire, what I'd like you to have a go at doing is pop in the mouthpiece inside your mouth, okay? Now what I want you to try and do is take a nice breath in, so breathe in through the PEP, and then I want you to breathe all the way out. Keep going, keep going, keep going, keep going, keep going, and relax. So that was a perfect length of breath, and you were breathing in through the PEP as well. So what we need to have a little look at now is what pressures you're actually achieving on the manometer. So obviously there's different size holes on there, so we're going to just start off, make sure it's on the easiest one, and then we can always build up. So we're on hole size 1.5, so that's fine. So what I want you to do is have a little look at the manometer whilst you're blowing, and we want to be aiming between 15 and 20 whilst you're blowing out. So take breath in for me, and then breathe all the way out. Keep going, keep going, keep going, keep going, keep going, and relax. So where did you get to on the manometer then? 20. Brilliant. So we want to be consistently staying between 15 and 20 throughout the whole length of the breath out. So that's actually the right size hole for you. What we might find is that if you become unwell, it might become a bit harder, or we might need to alter the hole size pressures. Or if you actually grow, then sometimes we need to go up on the hole sizes. So if you bring your manometer and your PEP along to clinic, then we can always keep checking and monitoring that you're on the right size hole resistor for you, okay. And then we can review that. So what I would like you to have a go at doing now is doing 10 breaths. I'm not going to show you the manometer this time, so I want to make sure that you're still managing those pressures without getting the feedback. Okay. So if you can, breathe in through the PEP, and then breathe all the way out. Keep going, keep going, keep going, keep going, keep going, and relax. And again. Brilliant. And relax. Good. Perfect. And as you can see, while Claire's doing that, she's probably unknowingly doing it, but she's got her shoulders nice and relaxed. She's sitting upright, so we're optimising clearing out the chest. Good. Okay, I'm going to show it to you again now, so you can see that you are still getting the same pressures there. Keep going, nice really long breaths, and relax. Brilliant. Okay, so what we want to be doing is doing 10 breaths, and then following 10 breaths we want to be huffing and coughing so that we're actually clearing the secretions out. So we've obviously done all the good work to open all the smaller airways up all around the edges of our lungs and mobilise and move the secretions from the smaller airways into the larger airways. So now we want to make sure that we're actually getting the secretions up. So I want you to try and do a huff for me. So I want you to take a breath in And then do a prolonged breath out, but I want you to try and keep the back of your mouth open. So it's a bit like you're steaming up a glass mirror, really. So it's a breath in and a so you can get no more air out.
Okay.
And that basically just moves the secretions a little bit higher, so that if there's anything there, when you're coughing, it's much more effective. And what we don't want you to be doing is coughing lots and lots, but actually clearing nothing up. It needs to be a very effective cough, and this just helps to make the cough more effective. So if you can take a breath in for me, and then do open your mouth and keep going. Is that okay? Just try that again for me. So breathe in, just a little bit more force if you can. Perfect. So you can hear that sound when you're making it. And then if you can have a nice strong cough, so hand over your mouth. Brilliant. Okay, feel like there's anything there to clear?
No.
Perfect. So, and it might be that when you do your physio treatment, so your PEP device, that there isn't anything to clear, but we're making sure that we're opening up the airways as well as clearing secretions. Okay? Have you got any questions about the PEP?
No.
No?
I think you said that we're going to
Yep.
check our pressures when I come into clinic,
Yep.
and then we can change the whole size.
Brilliant. So how often do you think you're going to need to do your PEP?
Once a day?
Yep, and I think when you're well, once a day is probably adequate. Obviously, all of the treatments are going to be tailored to how you are and how you present. So speaking to your physiotherapist that you see in clinic is really important, so you know what you should be doing when you're well. When you're poorly, you build up more phlegm and more secretion, so it's really important when you're poorly that you're clearing your chest more frequently. So if you became poorly, had a cough, had a cold, then I would probably expect you to be doing your PEP twice a day, so that you're clearing it out in the morning and the evening time. And then the amount of cycles that you do is also very dependent on how you are presenting clinically. So again, that would be a discussion with your physiotherapist about how many cycles you do and what works best for you. So if you found that you were poorly and you were still coughing by the normal amount of cycles that you would do, then we would probably say to carry on going until either it became clear and there was nothing left on your chest, or you'd reached the maximum of 10 cycles. Does that make sense?
Yeah.
Yeah.
Thank you.
Lovely.